Chromatic cataract. Now, as the name suggests, it's due to trauma to the eyes. And the typical shape is Rosette cataract because it's in the shape of a flower. See, you can look at this flower. It's such a beautiful flower over here. Okay, this is the Rosette cataract and it's a sign of blunt trauma or concussion to the eye. Okay. Now, the cataract is formed several years after a blunt trauma to the eye. It's formed several years, remember this, okay? Then it's found commonly in the posterior cortical region. So, it's a posterior cortical cataract, and when a patient presents with a Rosette cataract, always elucidate a history of trauma. Sometimes the patient might forget that he had an injury, but you have to elucidate that history. Now, let's look at complicated cataract. As the name suggests, it is a secondary cataract due to some other ocular disease. It's a complication of some primary ocular disease. Most common cause is uveitis, followed by glaucoma, retinitis pigmentosa, and high myopia. Okay, uveitis, glaucoma, retinitis pigmentosa, and high myopia. Now, three important points very frequently asked in your exams. The most common type is the posterior subcapsular type, you can see in this picture, and it is characteristic polychromatic luster and breadcrumb appearance. These words are frequently asked. These are related to complicated cataract. Polychromatic, it has multiple colors, multiple colorful luster when you examine it on the slit lamp, and then there's a typical breadcrumb appearance to this complicated cataract. Now let's look at metabolic cataract. Now, metabolic, as soon as I say that word, you can understand that the most common cause will be diabetes, and it's the diabetic cataract. However, we have to differentiate between an early senile cataract and a true diabetic cataract. So the early senile, as the name suggests, it occurs around 40 years of age, and true diabetic cataract or the snowflake cataract can occur even before the age of 40 years. Early senile is seen in type 2 and true diabetic cataract is seen in type 1 of diabetes mellitus. And early senile is of chronic onset, and here a striking feature is that it is the only cataract with an acute onset. Overnight it can develop. Okay, so it can occur at any age of the patient because type 1 has a very long duration of diabetes. It can occur at any age of the patient and it has an acute onset. The only cataract with acute onset is true diabetic cataract or the snowflake cataract. The early senile cataract has no shape. This cataract is famously known as the snowflake or snowstorm appearance. Look at this picture. It's as if there's a snowstorm going on inside the eye. So that is why it's called a snowstorm cataract. Okay. Now let's look at Wilson's disease. It is a reversible cataract. Once you treat the disease, the cataract reverses. Okay. Now, the typical cataract is your sunflower cataract. You can see in this picture, the cataract is in the shape of a sunflower. And another finding, we know that it's the Kayser-Fleischer ring, okay, encircling the iris. No, it's not the cataract. The Kayser-Fleischer ring is an iron-copper deposition. Now, why do I say that Wilson's disease cataract, that is sunflower cataract, is reversible? Because when excessive copper is treated, the cataract dissolves. Okay, when the excessive copper is treated with copper chelating agents, the cataract will dissolve and the patient will have normal vision. That is why it's a reversible cataract. Now, Galactosemia is a typical beautiful oil droplet cataract over here. This is also reversible by withholding galactose. Now let's look at the cataract in myotonic dystrophy. It's a Christmas tree cataract. Okay, see, you can see red color, green color luster from the cataract. That is why it's called a Christmas tree cataract. How will you know that a patient is myotonic? Is because there's increased tone of the muscles in this patient, and the diagnosis you will do by a hatchet face, a frontal balding, and tonic muscles along with your Christmas tree cataract. Now, Fabry's disease has a propeller or spoke-like cataract. So, Fabry's cataracts are very rare and do not usually impair vision and do not require removal. See, this looks like a propeller, the opacification. It's the commonest ocular finding in Fabry's disease is cornea verticillata and not the cataract. Okay, the commonest ocular finding in Fabry's disease is cornea verticillata. Now, in atopic dermatitis, you have a shield-like cataract. See, the shape resembles a shield. Okay. Now, this is an anterior subcapsular type of cataract. Okay, anterior subcapsular type of cataract. Another type of cataract is your heat cataract caused by an immense amount of heat to which the lens is exposed. It is a true exfoliation cataract, also called as glass blower's cataract or the iron worker's cataract. We know that glass blowers and iron workers work in very high temperatures. So because of this, there is a cataract occurring in their eyes. Okay. Now, radiation cataract is caused due to ionizing radiations, and non-ionizing radiations do not cause any cataract. Most common ionizing radiation all of us are exposed to are X-rays. Okay. This is a posterior subcapsular type of cataract. Now, lens damage occurs first amongst all the ocular structures. None of the structures of the eye get damaged as early as the lens because it is highly sensitive to radiation. Let's look at drug-induced cataract. Systemic steroids, most important, first have to come to your mind. Drug-induced steroids cause posterior subcapsular cataract. Then chloroquine, amiodarone, and busulfan, icothiopate, penicillamine, gold, and chlorpromazine. All of these can cause drug-induced cataract, and chlorpromazine typically causes a star-shaped cataract. Okay. Now, for exam, let's see, the posterior subcapsular cataract is caused by three types of cataract: steroids, complicated cataract, and radiation-induced cataracts. Okay, all of these cause posterior subcapsular cataract. Steroids, complicated cataract, and radiation-induced cataract.
Hello everyone, this is Dr. Sai Suguna, your mentor for ophthalmology at Medico. Now, thanks for watching the video. Now we have put such videos all together in our ophthalmology app. The trial version you can download from the link over here or in the description box below.